Hey everybody, welcome back to my channel, Plant Rich Sandra. Sandra here. Thank you for joining me again today. I really appreciate your time. Today I want to talk about fiber. I had originally meant for this presentation to be on beans, but as I began to research the many great qualities of beans, I got kind of hung up on the amazing benefits of one specific quality, which was fiber, and I decided that this topic needed to be a presentation of its own. And it would be a great idea to talk about this before even getting into a discussion of beans themselves. So when folks first find out that you are whole food plant-based, or that you are nutrient dense, plant rich, or that you're vegan, the first thing they always say, of course, as you know, is, well, where do you get your protein? But since there is no such thing as an American who is protein deficient, then in all honesty, this is really not a valid question to ask. And if anybody does ask you that question, then here would be a great response to say to somebody who says, where do you get your protein? You say, that's a great question. Tell me, how many grams of protein should the average American be getting per day? And then you wait expectantly for them to give you their answer based on the fact that they've done their research and they actually know. But the thing is that if they've asked you where you get your protein when they find out that you're plant-based, I guarantee you that they will not know the answer to your counter question of how many grams of protein you should be getting in a day. So at that point, you turn this into a teachable moment, and then you tell them, actually, the average adult should be getting about 0.36 grams of protein per pound of their weight per day. And that would put most average or sedentary adults at between 40 to 60 required grams of protein per day. Therefore, a 120-pound woman would need an average of 43 grams per day, for example. A 160-pound man would need roughly 58 grams per day of protein, and I get an average of, and then you tell them what your average protein intake is per day, 60 grams or 50 grams or whatever yours is of plant protein, then you tell them that. But then you say to the person, but the more important question here is not about protein. The more important question is, where is one getting their fiber per day, their daily required intake of fiber? Because unfortunately, there is a huge percentage of Americans who are fiber deficient. And a lack of sufficient fiber in our daily diet can lead to a myriad of diseases. So this is the moment that you can really get into a discussion about daily dietary fiber. So the first question I want to answer today is, what exactly is fiber? And I forgot to say this at the beginning, so let me go ahead and say this now, is that this is not a video that you need to actually be sitting and watching me. Okay, this is one where you can set your phone down and go do stuff. Go do dishes, go fold a load of clothes. You can listen to this video while you're driving. You can be cooking. You do not need to be watching me right now, because literally I have no visuals in today's presentation, in today's discussion, no visuals. So no need to even be looking at me right now, okay? Just go do something productive that doesn't require a lot of brain power, so you can be listening but not watching. Okay, so dietary fiber. Dietary fiber is the part of our food that is indigestible and non-absorbable. It is the part that just goes straight through us, and it takes unwanted stuff with it. Now, I want to stop right now, and I want to change one word in my definition. My definition of dietary fiber said that it is the part of our food that is indigestible and non-absorbable. And what I'd like to do right now is change that word food to plants, because there is actually zero fiber in any animal food. So there is no use even bothering with the word meat in this discussion. All meat is without fiber. And if you don't believe me, you can research this on your own. There is no fiber in dairy cheese. There is no fiber in dairy milk. There is no fiber in poultry, chicken, duck, turkey, zero fiber. There is zero fiber in pork, all porks products, ham, white pork, etc., pork butt, zero fiber. There is zero fiber in every beef product. Ground beef, top sirloin, doesn't matter. There is zero fiber in any beef product. There is zero fiber in fish. There is zero fiber in any seafood. So that's just the first thing I just want to go ahead and say right now. And as I just said, a lack of sufficient fiber in our daily diet can lead to a myriad of diseases. And now I would like to mention a few diseases that are brought about by a lack of fiber in your daily diet. The first two are direct results of a fiber deficient diet, of a low fiber diet: diverticulosis and diverticulitis. These are two direct results of a low fiber diet. What is diverticulosis? It is when pockets or sacs, which are actually called diverticula, form in the walls of your digestive tract. The inner layer of your intestine pushes through the weak spots in the outer lining. So our intestines have an inner lining and an outer lining. And when there are weak spots in the outer lining, then little pockets are going to push through those from the inner lining to the outer lining. And this pressure is going to make them bulge out, that make little pouches on the outside of your colon. Most of the time this does happen in your colon, which is the lower part of your intestine. Your large intestine is also called your colon. Now the interesting thing about diverticulosis is that there are no symptoms. So you may feel absolutely nothing. You may not even realize that you have diverticulosis. However, diverticulosis can turn into diverticulitis, and that is a very, very different subject. Diverticulitis happens when one or more of those pockets gets inflamed or infected, and this will cause severe pain in your abdomen. And then if you're interested in my document, I do have a few pictures in the document, specifically here of somebody who's they've sent the camera down. They're doing a colonoscopy, and an absolutely clean colon, and you can see the holes in there. You can see the pockets. So I have that picture. If you are interested in that, all you need to do is send me an email to sanka61@yahoo. My son said that this is the 21st century, it's 2019, and I need to start using my Gmail, but my Yahoo is my I've had it for a long time, it's my most used email, so that's the one I'm going with. Sorry about that, Ian, but it's Sanka, like the old decaf coffee brand, Sanka61, the year I was born, @yahoo.com. Send me an email and say your documents, your health documents, and I'll be happy to email you everything I've done so far. This is going to be my 5th one, and I'll be happy to email them all to you. Okay, so I have another picture here of an even worse situation of diverticular disease. And by the way, this is also known as colonic diverticular disease, diverticulitis is. CDD. This causes the sacs, as I mentioned, to form that protrude externally through the colon wall. They become inflamed, infected, and unfortunately, they also may rupture. If they rupture, then hemorrhaging may occur with the inflammation of the peritoneum, which is the lining of the abdominal cavity, or abscess formation. They're more common with age, and they result in fever, vomiting, and pain. And then there are treatments. Then one of the most dramatic treatments is going to be removing a part of your colon. A diet that is low in fiber is inherently, or by its very nature, it is going to be low in the things that we as whole food plant-based folks eat in volume on a daily basis. But a low fiber diet is naturally going to be low in those things. Whole vegetables, fruits, beans and other legumes, whole grains, healthy fats that have their accompanying fiber right along with them, nuts, seeds, avocados, not nut oil, not walnut oil. I'm talking about whole walnuts, not avocado oil, but I'm talking about whole avocados. If a person is not eating these foods that I just mentioned, then they're eating something. And what they are eating is that they are building their diet on fiber-free animal products and other types of processed foods that have a high calorie content. Junk food, boxed foods like Kraft macaroni and cheese, in order to reach satiety after a meal. That word satiety is that feeling of satisfaction in your stomach, that feeling of fullness, that's satiety. And you got to be reaching it. And so if you're not eating these things that are high in fiber that can give you that feeling of satiety, then what are you eating? You're eating high calorie junk foods. You're eating meats that are giving you absolutely no fiber. This type of low fiber eating pattern can bring about some of the following conditions. It can bring about higher cholesterol levels, which can lead to heart disease. However, if you will increase the fiber intake, that is a safe and inexpensive dietary strategy to reduce the risk of heart disease. High intake of dietary fiber is known to reduce your total cholesterol and your triglyceride levels, while it will increase your HDL cholesterol level, the good cholesterol. This type of low fiber eating pattern can also bring about higher blood sugar levels, which can lead to diabetes, and I'll talk more about blood sugar levels later. This type of low fiber eating pattern can also bring about, here's a euphemism for you, positive calorie balance. I mean, that just sounds so pleasant. It's even got the word positive in it. Positive calorie balance. And what is that? That is when at the end of the day, you can end up consuming more calories than you burnt off. So your balance for calories is positive, okay, not negative. You will lead to weight gain, which ultimately, unfortunately, is going to lead to obesity. However, dietary fiber can play a role in preventing obesity by the following points. It can increase the amount of necessary chewing, which will thus slow down your eating process. You can imagine if you drink 200 calories of apple juice. I could down that in 10 seconds, but I cannot eat a whole apple in 10 seconds. So as I'm eating a real apple, my stomach has a chance to send the signal up to my brain that I'm feeling satiated because I gave my body a chance to chew, swallow, eat the apple. So there's time to send the signal up that I'm satisfied sooner. So a little glass of orange juice, 200 calories of orange juice, same thing, choop, gone. If I take 200 calories of walnut oil and I put it over a salad, put it over something and eat it, like maybe some hummus or whatever, and I down that hummus with some tortilla chips, then I have taken that oil and I've swallowed it all and it goes straight in and stored on my system, as opposed to eating a little handful of walnuts with their accompanying fiber. All right, so whenever you are getting in more dietary fiber, you are doing another little thing, and it's going to have an word in it. You are increasing your fecal caloric loss. And what that means is that the fiber is going to push the waste on through your intestines at a faster pace, causing your body to absorb less of the unwanted material during its shorter travel time. Okay, and I'm probably going to mention this again in a little bit, but for now I just want to mention that when you're getting fiber along with the food, even a fatty food like whole walnuts or whole almonds, the additional fiber there is going to go through your intestines much quicker than just the main product, and so it's going to take calories out with it, that if those calories are just sitting in there, then they're going to be absorbed into your body because they're just sitting in there. Whereas if it's accompanied by its fiber, it's going to be pushed on through at a much faster rate, and it won't be sitting there, and some of that fat is going and other things in there, in that food, is going to head on out the door much quicker and not be absorbed. Okay, there are, sadly, more serious conditions now that I want to mention besides the ones that I just said. So what have I said so far? I've said diverticulitis, diverticulosis, and then I mentioned heart disease, and I mentioned diabetes, and I mentioned weight gain leading to obesity. These are some terrible conditions that can be brought about by a low fiber diet. Now I want to mention some more serious conditions as well. This first one I'm going to mention is the one that got my father, which is colon cancer. What exactly is colon cancer? This is a very sad section, I'm very sorry to say. Colon cancer is a type of cancer that begins in your colon, in your large intestine, and the colon is the final part of the digestive tract. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as a small, non-cancerous, aka a benign, clump of cells that are called polyps that form on the inside of your colon. Over time, some of these polyps can become colon cancers. Polyps may be small, and they may produce few, if any, symptoms, so you don't even know they're in your colon. For this reason, doctors do recommend regular screening tests to help prevent colon cancer by identifying and removing polyps before they turn into cancer. This is actually one thing that I did a year or two ago. I did have a colonoscopy, and the doctor found 2 or 3 polyps and went ahead and snipped them off. So the next is IBS, irritable bowel syndrome. I wasn't exactly sure what IBS was, so I have really learned a lot in putting this presentation together. Irritable bowel syndrome is a common disorder that affects the large intestine. Signs and symptoms include cramping, abdominal pain, bloating, excess gas, diarrhea and constipation, or one or the other, or both, okay? Mucus in your stool, rectal bleeding, unexplained vomiting, and persistent pain that is not relieved when you do pass gas, or if you have a bowel movement, you still have the pain. IBS is a chronic condition, and that you will need to manage it long term once you get IBS. Some of the factors that appear to play a role in the formation of IBS, they're not really sure yet, but your muscle contractions. Y'all have seen a snake, how they go like this on their back, you know, the muscles, okay? Well, your colon kind of does that. It contracts like this, and the walls are lined with layers of muscle that contract as they move food through your digestive tract. Well, if those contractions are stronger and last longer than normal, than they should be, they can cause gas, bloating, and diarrhea. Well, if those contractions are weak, intestinal contractions, they can actually slow the food passage. And that means that it's going to be sitting, the stool is going to be sitting in your intestines for longer than it should. And as it's sitting in there, your colon is pulling water out of it, constantly pulling water out, which is going to lead to hard, dry stools. Most of us, especially adults, have experienced hard, dry stools. That is a sign, one of the signs of low fiber diet, meaning that the stool is not being pushed out with the help of high fiber in your stool. It's sitting there, and the longer it sits there, the more water is pulled out of it. So it comes out as a hard, dry stool, which is very, very painful. Your nervous system. If there are any abnormalities in the nerves in your digestive system, that may cause you to experience greater than normal discomfort when your abdomen stretches from gas or from a stool. Poorly coordinated signals between the brain and the intestines can cause your body to overreact to changes that normally occur in the digestive process, resulting in pain, diarrhea, or constipation. The third bullet here is inflammation in your intestines. Some people with IBS have an increased number of immune system cells in their intestines, and this immune system response is associated with pain and diarrhea. Severe infection. IBS can develop after a severe bout of diarrhea, which is called gastroenteritis, caused by bacteria or a virus. IBS might also be associated with a surplus of bacteria in the intestines. And then finally, another possible cause is some changes in the bacteria in your gut, which is called your microflora, and I'm going to talk about that more too. But microflora are the good bacteria that do reside in your intestines, and they play a key role in our health. Research indicates that microflora in people with IBS might differ from the microflora in healthy people. Now, at this point in my document, if you're interested in my document, I do have an amazing link here to a website about the importance of dietary fiber for people who are suffering from IBS, or to help prevent from getting IBS. The next condition is ulcerative colitis. Ulcerative colitis is an inflammatory bowel disease, an IBD, that causes long-lasting inflammation and ulcers in your digestive tract. An ulcer in your system is basically a sore, an open sore inside your body. Ulcerative colitis affects the innermost lining of your large intestine and your rectum. The air just shut off, so I think you can hear me better now. Symptoms usually develop over time rather than suddenly, and ulcerative colitis can be debilitating and can sometimes lead to life-threatening complications. Once again, I have a very, very, very helpful link here called Foods to Avoid. There, the air just came back on. Foods to avoid if you suffer from ulcerative colitis. So I think that you would really appreciate this document. If you're interested, just email me and let me know. The next condition is appendicitis. And I had to go back and double check this. I'm thinking, I thought appendicitis was just kind of a random thing, but apparently a low fiber diet can lead to appendicitis, acute appendicitis. And once again, I have a great document from the National Institutes of Health, and it's a PubMed document here that you can click on and read that is acute appendicitis is linked to a low fiber diet. Okay, what exactly is appendicitis? It is an inflammation of your appendix, which is that finger-shaped little pouch that projects from your colon on the lower right side of your abdomen. Appendicitis causes pain in your lower right abdomen. However, in most people, the pain begins around the navel and then it moves. As inflammation worsens, appendicitis pain typically increases and eventually becomes severe. Although anyone can develop appendicitis, most often it occurs in people between the ages of 10 and 30, and standard treatment is surgical removal of the appendix. Okay, now we move to a few more conditions that are a little bit less severe than the ones I've just mentioned. Okay, number one, hemorrhoids. Hemorrhoids, which are also called piles, P-I-L-E-S, are swollen veins, this one I hate talking about, in your anus and in your lower rectum. They're similar to varicose veins. They can develop inside the rectum, which are called internal hemorrhoids, or they can develop under the skin around the anus, which are called external hemorrhoids. And again, I have an awesome link here, again from the National Institute of Health, digestive diseases, and eating, diet, nutrition, things you need to consider to help prevent, to either reduce and eliminate hemorrhoids you already have, or to prevent you from ever getting hemorrhoids in the first place. You guessed it, a high fiber diet. So high fiber diet is indicated in many, many situations of superior health. There is no fiber in meat. There is fiber in vegetables, fruits, whole grains, nuts, seeds, avocados, beans, and other legumes. That's where you're getting your high fiber, folks. Okay? Please keep that in mind. Okay, next is peptic ulcers. Again, what is an ulcer? It's a sore. It's an open sore. A peptic ulcer is an open sore that develops on the inside lining of your stomach or in the upper portion of your small intestine. The most common symptom of a peptic ulcer is stomach pain. Peptic ulcers include gastric ulcers that occur inside your stomach, and duodenal, I'm not sure if I'm pronouncing that word right. I don't think I am. I think it's duodenal. That's D-U-O-D-E-N-A-L, duodenal ulcers that occur on the inside of the upper portion of your small intestine. Okay, your duodenum. Duodenum. I remember that word from high school science. Duodenum. You tell me, please. Please remember, y'all, I am not a professional. I'm a layman, and I'm trying really hard here. I've spent hours on this, trying to present this in layman's terms, in ways that I can understand. Hopefully then you can understand these things as well. So, the most common causes of peptic ulcers are infection with the bacterium, and I've got a list here, okay, of with the bacterium Helicobacter pylori, H. pylori, and long-term use of aspirin and NSAIDs, non-steroidal anti-inflammatory drugs, NSAIDs, Advil, Aleve, and others can lead to ulcers. Stress and spicy foods do not cause peptic ulcers. However, they can make your symptoms worse. Okay, now in this document, I'm not going to finish reading this, but I just want to say research shows that a high fiber diet decreases the risk of developing ulcer disease. Although both insoluble and soluble fibers demonstrate this association, there is a stronger association between diets high in soluble fiber and a decreased risk for developing ulcers. Again, an awesome link for you here from the Canadian Society of Intestinal Research, a diet for ulcer disease. These are all, everything I just mentioned, are major problems suffered by Americans today. They're very common in our country. Okay, I'm going to pause here and then restart this now that I'm ready to actually start talking about fiber. Okay, here I go.